Welcome to this episode of Substantial Matters, Life and Science of Parkinson's. I'm your host, Dan Keller. At the Parkinsons Foundation, we want all people with Parkinson's and their families to get the care and support they need. Better care starts with better research and leads to better lives. In this podcast series, we highlight the fruits of that research, the treatments and techniques that can help you live a better life now, as well as research that can bring a better tomorrow. Managing Parkinson's disease is a team effort involving healthcare providers, the person with PD, and their supporters. These team members often come together at a doctor's visit. And to make the most of a visit, a plan can help. In this episode, Health Psychologist Dr. Taylor Rush of the Center for Neurologic Restoration at the Cleveland Clinic offers some suggestions in planning for the visit, talking with your doctor, and what to do between visits. She also has some advice for overcoming obstacles if they arise in discussions with your doctor. When we spoke, I first was curious about how a psychologist comes to work in the Parkinson's area. Dr. Rush, let me first ask you a little bit about yourself and what led you to work with people living with Parkinson's.
I'm a health psychologist by training, meaning that my schoolwork in grad school and training was done in hospital or outpatient health settings. And I was asked to start a behavioral health service within our movement disorders center at Cleveland Clinic, as they had not had that service available up until that point. So I was very happy to oblige, as I knew that psychological support for the Parkinson's journey is such an integral part to successful management. So from there, that was 10 years ago now, I was able to build a service line that now includes 2 other health psychologists, 2 social workers, 2 psychiatrists, as well as a psychiatry physician assistant. Our goal is to address the psychological and neurobehavioral needs of our patients who have Parkinson's.
That's great. It sounds like you have a much more highly staffed and better facility than a lot of places would.
We're incredibly lucky, absolutely.
Let's talk about how people can make the most of their Parkinson's doctor visits. Why do you think this is such an important topic?
I would say that this is a topic that comes up often when I'm working with patients, as they recognize that these visits are often incredibly short, and often there's a lot that they want to discuss during a very limited amount of time. So they feel a sense of pressure to be as efficient as possible, but aren't always entirely sure how. And often they may leave appointments feeling like questions were not addressed, or perhaps they forgot to ask them. And I think historically, there has been this belief that the doctor knows best. So a lot of people come into visits expecting the provider to structure the time and, make the best use of it. But really, it ought to be a more collaborative exchange with what's concerning to you as a patient, as well as what maybe the provider notices in terms of their exam. So it's not just one perspective, it's both of you bringing your ideas and your observations to the table. And when an appointment ends without covering what matters most to you, it means that you might have difficulty for the next, sometimes upwards of 6 months before your next appointment, to really initiate a plan that's going to work most effectively. So it's incredibly important to make sure that you feel empowered and prepared for these visits.
What's a good way to start for someone to take this more active role in their own care and dealing with that doctor's appointment that often has limited time?
I would say that, first off, preparation is absolutely key to a successful visit. So I will often encourage people to really take time to reflect before the visit on understanding where you are, what's going on with your symptoms, what are any particular concerns or challenges that you might be experiencing, and those can be physical challenges, sometimes they're emotional challenges, and how are they affecting your quality of life? and really trying to hone in on what you feel like needs to be addressed in order to enhance any personal goals that you have. So I have patients that'll say, I'm really having trouble with stiffness and it's affecting my ability to play golf, or my balance has been more of an issue lately, and so my ability to garden has been really affected by this, or I'm having an incredible amount of fatigue, and so time with my grandkids has become much more limited, or my tremor has gotten to a point where I'm really self-conscious and I'm not going out socially as much as I used to. So how can you link the concerns that you have with the things that matter most to you in your life? And coming into the appointment with those concerns outlined can really help to make use of that time as best as possible.
I know doctors sometimes get frustrated by what they call the door handle symptom. You know, the person says at the end of the interview, just as they're just going out the door, oh, and by the way, I have this other troubling symptom, which is fairly major. So I guess it's a good idea to get that out up front and not hold back.
Absolutely. And often what I will advise people is start with the most important thing. Don't save that for last, because sometimes people say, oh, I'll get the small stuff out of the way first. However, sometimes that ends up eating up most of the appointment, and then you haven't even addressed the thing that matters most. So really try to go in order of importance, with the most important thing coming first instead of last, in order to avoid that door handle predicament.
The Parkinsons Foundation has information how people can optimize their care, including their time at the doctor, and it's available on the Parkinson's website at parkinson.org/optimizingcare. And the section called Making the Most of Your Parkinson's Care envisions doctor appointments as a cycle: before the visit, getting ready, during the visit, and then what to do between visits. And it's also got a worksheet to that end. So thinking of Parkinson's disease care as a cycle, time before the visit, during the visit, between visits, how can people use the worksheet to guide them in picking their topmost concerns for their visit?
Absolutely. So you're right. The Parkinsons Foundation has a fantastic new worksheet on ways in which you can best prepare for your appointment. And what I really like about the worksheet is that it's not just focused specifically on just the physical symptoms of Parkinson's, but also the emotional symptoms, how it affects your ability to engage with your support network, so your family or friends. And we have some individuals with Parkinson's who are still working, and how does it affect their ability to do their job? How does it affect their ability to do everyday chores and functioning? And this is the part I think a lot of people leave out, is enjoyable activities or hobbies, because we think, oh, maybe the doctor may not really care much about that, but you care about that. And it is an important aspect of quality of life. So I love that the worksheet breaks down into thinking about how Parkinson's affects all areas of life, and then being able to understand not only just what your symptoms are, but how do you link that to the goals of what matters most to you? What are your values? And, it might be that I really enjoy traveling, but my symptoms are making that harder for me, or I'm feeling less confident about doing those things. And so thinking about how do I link my symptoms to the things that matter to me, and then how do I then structure that in terms of a concern that I can bring up to my provider. And so in the part 2 of the worksheet, it talks about ways in which to decide what is most important for the appointment. So how do you pick your top 3, and writing those out depending on how much those symptoms affect different areas of your life. And being able to make sure that you recognize that, it may be that, hey, tremor affects 1 or 2 areas of my life, but some of my balance issues affects way more. So for me, maybe balance issues goes into that number 1 slot and tremor goes into the number 2 slot. So thinking about how pervasive those symptoms are and how they affect you, it kind of can help you to then order your symptom topics depending on how pervasive they are. So I really do appreciate that worksheet and encouraging my patients to use it as well. And I think when it comes to the Parkinson's appointment cycle, thinking beforehand, again, making a list of your top 3 questions or concerns using that worksheet, making sure that you advocate for your needs during the appointment, and then between visits, so depending on the person and their practice with their provider, it may be 3 months, it may be 6 months before they see them again. So what is it that they need to do in the meantime to help themselves to live well? Does that mean that they need to engage in a support group that is nearby? How do they appropriately engage in an exercise program? How can they access local resources or resources through professional organizations like the Parkinsons Foundation so that they can make the most of those things that are available to them and make strides towards managing their Parkinson's in between those appointments?
Do you think using the worksheet or just making notes yourself helps overcome some of the nervousness people may have about speaking up with their doctor? They know the doctor's busy. They know there's a bunch of people in the waiting room, and they still need to get out what they need. So if you have it as notes and written down, do you think that helps kind of give it a little more empowerment and emphasis?
Absolutely. I think when we are able to write things down and reflect on them ahead of time, it helps us to then describe what we're feeling and how we're impacted by things much more efficiently. Oftentimes, if we don't prepare, we may say a lot to say a little. So we often use a lot more words to explain something than if we're prepared. We can be much more succinct and efficient. And so that can bode very well if your appointment is only maybe 20 or sometimes 15 minutes or up to 30 minutes long. So the more you can be prepared and the more that you have those things written down as prompts ahead of time, one, it then serves as a reference point for you and your provider when you go into the visit. But two, it helps you to then navigate that visit in a much more productive way.
What should a person do if the provider doesn't seem to be terribly receptive to what they're saying? Maybe they feel rushed, and maybe the person is feeling that the provider is dismissing what they're saying. What do you do about that?
Yeah, that can be an incredibly challenging situation and can make people certainly feel somewhat intimidated. So one thing that I often tell people is that it's important to remember that you are the world's leading expert on you. And it's important for you to be able to express your concerns during this visit because it is your visit and this is your life. You're the one who heads home and has to cope with your symptoms within your body after this appointment is said and done. So it is important, I think, to keep that in mind, even if the physician doesn't quite seem to be on the same page as you. So one thing I think can be helpful in those situations is that if you do have your top 3 concerns written down, start the appointment by introducing that paper to your provider. And it can help to shift into a more proactive dynamic. So it's not the physician necessarily leading the conversation. You're leading the conversation with the things that are most bothersome to you. And sometimes even my patients may send me their concerns ahead of time through our patient portal, which is my chart. And so they'll send a message to me ahead of time saying, just want to let you know, these are the things that I want to make sure we discuss during our next appointment. So then that way we both have time to reference it during the appointment. Mm-hmm. So I think that can sometimes help a bit in those situations. And sometimes if you feel like the doctor may not quite be understanding what you're saying or you feel like they may be minimizing something, it's important to make sure that you reiterate what it is that your concern is. So if they're not fully explaining something, and you may say, I think I hear what you're saying is that you want to make a medication change, let's say, but I'm really not quite yet understanding how that is meant to best address my tremor. So can you explain that a little bit more to me? So sometimes if we drill down into somewhat more specific questions, that can sometimes help the provider to orient to that specific concern. So sometimes we have to help them out a little bit by being a bit more pointed with the questions. So sometimes that can also help.
I suppose sometimes the question is this the right provider for this question or condition I have? Just because you have Parkinson's doesn't mean you can't have some other stuff. If you feel stiffness, is it Parkinson's or is it some sort of arthritic condition, things like that? Or even you've got stomach problems. Is it a GI problem? Is it in the Parkinson's realm? Or a heart condition can be completely different. So where do you draw the line, or how do you deal with the doctor and get the right condition to the right doctor, I suppose, is the question.
Absolutely. And I think it's important to remember that the onus is not necessarily on the patient to make that decision, because you're not the one who has that level of expertise in medical issues, right? And so often what I'll tell people is that it is still important that you bring it up to your neurology provider and ask for guidance on who would be best to address it, so that maybe then they can help facilitate a referral or recommendation to the provider that it would be most appropriate to address. But you're right, there are a lot of overlapping issues with like stiffness, as you said, or GI issues, or some people do experience like orthostatic hypotension. And so is that a medication issue related to their Parkinson's? Is it the Parkinson's itself, or is it something separate with a cardiac concern? A patient can't know that up front, and really it's going to be a collaborative conversation with their provider on, is this part of Parkinson's, or is this something that requires another set of eyes? But that's going to be on your provider to help navigate that, because you can't know what you don't know.
Do you have any suggestions for what a patient should do if they're out of time in the visit and some of their concerns have not yet been addressed? What's the next step for them?
That can be frustrating too, because maybe you have your top 3 things all delineated and then you only get through 2 of them, or the first one is just so big it covers the entire visit. So depending on the nature of the concerns that weren't addressed, sometimes those are things that can be followed up with on the patient portal. So again, we have patients that will follow up with us on my chart and say, oh, I did have this question and we didn't have time to address it. And if it's something short and easy, oftentimes our providers will offer an answer in my chart. But if it's something that requires a bit more of an extensive conversation, sometimes it's possible to schedule a separate follow-up with an advanced practice provider. So in our practice, we have nurse practitioners, we have physician assistants who work with our neurologists to provide patient care, and often will see patients in between their visits with their neurologist. And they can often answer a large scope of questions. And if they don't know the answer, they can then triage that to the physician if necessary. So sometimes it can help to ask, is there another provider that I can follow up with about these other questions, and see what your provider's office can accommodate.
At the end of the visit, or when they're walking out the door, how can the patient make sure that they understood everything that was discussed? You know, it's a stressful situation and they may be thinking of their next question. How do they make sure that something didn't get by them that's important?
It can be helpful to take notes during your visit. You know, being able to write things down as you go, making sure that it seems to make sense. And sometimes it's okay to take a pause and say, okay, so let me make sure that I understood you correctly with what you just said. And that way you can then reflect back what you heard them say, and then they have an opportunity to say, oh, yes, you've got it. That's exactly what I said. Or they can say, oh, well, not quite. You know, actually, I meant this. So it provides an opportunity for clarification. And you can also perhaps ask the provider to summarize the visit and send it to you through the patient portal. We have providers who will do that routinely, where the visit summary is sent to them automatically, or they can print it so that the patient has a hard copy of it as well. So I think that sometimes clarifying exactly what you discussed can then help to prompt any other pieces or that may need to be clarified or better understood in order for you to leave that appointment feeling as if you're on the same page as your provider with your care plan.
Does it help to bring your care partner or some other extra set of ears with you?
Absolutely. I think if you have someone that can come, so whether that is a care partner or sometimes a trusted friend or other individual who'd be willing to sit in on the appointment with you. 2 sets of ears can be more helpful than one. So that is definitely one option to consider. Another, and this kind of depends on the rules of the practice. Some places have policies in place against this, but I know in our center, some of my patients will audio record visits on their phone because they're like, I just want to make sure that I can go back and listen to this again and make sure I really understood and absorbed everything. And so if you're allowed to do that, that can also provide an opportunity for you to have a reference point for your visit, as long as it's something that is acceptable for their practice policies. So those are a few options, even if you don't necessarily have a care partner that could come to the appointment.
And I suppose if you didn't have a care partner with you and you did record it, somebody else could listen to it with you later, make sure that you're getting it.
Right. Yes. And I've had people who've actually called in people that are in their life. So they may have had an adult child who lives several states over who can't come to the visit, but they will call them so that they can be a part of the visit over the phone. So that can also be an option as well.
Great. As we wrap this up, is there anything we've missed or interesting to add? And can you give a nutshell message to people who are going to be at a doctor visit?
Absolutely. I would just say that, again, remember that your medical visits are your time to speak up and make your needs known. The time is yours to be able to offer your thoughts, your perspective, share your values with your provider on what's important to you. And again, the more you can prepare ahead of time by writing things down, using the preparation worksheet offered by the Parkinsons Foundation, the more efficient and productive your time will be with your provider, which means better care as well as a better treatment plan that you can enact between appointments. So use your time wisely and make sure that you get your needs met.
And I suppose that time between appointments, when something occurs to you, it's probably a good time to write it down then. I know all of us are so busy, we get a thought, and then it's like, oh, damn, what was I going to write down?
I know, exactly. And so I tell people, if it's something that takes less than 30 seconds, do it in that moment. Do it right then, because otherwise you're right. It's in one ear and out the other. So as things come up, have a pad of notepaper handy, or I have a lot of people who use the Notes app on their phone because most people have their phone with them all the time. So whatever helps you to prompt that observation or question, use it in that moment so that you have it to reference later.
Very good. Thanks a lot for all the helpful suggestions. I'm sure people will have more productive visits because of this, and they should get the worksheet too. So thanks. Take care.
Thank you so much.
To help you make the most of your care, including doctor visits, we have lots of information on our website at parkinson.org/optimizingcare. An important part of getting the best care is being able to advocate for yourself, including letting your health care team know what's important to you, your symptoms, concerns, goals, and what matters most to you. There's a link on the webpage to the worksheet that we mentioned to help you organize your thoughts to make the most of your time with your doctor. We also had a recent webinar on this topic. Visit parkinson.org/PD library and search for Taking Charge. If you'd like to leave feedback on this episode or let us know what other topics you'd like us to cover, visit parkinson.org/feedback. Be sure to subscribe and rate us on Apple Podcasts or wherever you get your podcasts. At the Parkinsons Foundation, our mission is to help every person diagnosed with Parkinson's live the best possible life today. To that end, we'll be bringing you a new episode in this podcast series every month. Till next time, For more information and resources, visit parkinson.org or call our toll-free helpline at 1-800-4PD-INFO. That's 1-800-473-4636. Thank you for listening.